At least 24 cases of measles have been reported in a West Texas county. It's the latest outbreak of a disease that had been virtually eliminated in the United States and serves as a warning for communities nationwide. Joining us now for a closer look is the New York State Health Commissioner, James McDonald. James, thanks for being with us. How are you?
I'm good, Chris. Good morning. And thanks it's an important topic. I'm glad we want to talk about
Without a doubt. Let's start here in New York, though, when it comes to measles. What are the latest case numbers in the city and in the state?
Yeah, so we haven't had any measles cases yet in 2025. Last year, though, we had 15 cases, and that's a lot for a disease that was eliminated in the United States in the year 2000. So it concerns us, and we're following the Texas outbreak very closely. We're also following an outbreak in Quebec as well, because measles doesn't know the borders of any state or any country, and Canada's close to us.
So let's talk about this county in West Texas where this outbreak is currently happening. It's got one of the highest rates of vaccine exemptions in the country. In your opinion, this kind of outbreak sounds as if it could have been preventable.
Well, Chris, not just could have been, it's completely preventable. And I just want to be blunt about that. You know, it's completely preventable. When you think about the United States, measles was completely eliminated in our country and declared eliminated in the year 2000. The vaccine we have, the measles, mumps, and rubella, have been around a long time. It's the best protection we have to protect against measles. It really is the best protection out there. So a completely preventable outbreak. That's part of what makes it more sad.
This comes, as vaccination rates are declining in several states nationwide. Does this jeopardize what's called, herd immunity? And does hearing something like this, that there is such vaccine skepticism out there, even when it comes to things like this, measles, mumps, rubella, that people are going to tend to not make the right decision when it comes to preventing the spread of some of these diseases?
It really does jeopardize herd immunity, because really, when you think about the vaccine, it is the best protection, but it's best when we all get the vaccine. And really, when you think about measles, it is one of the most contagious diseases known to man. Like, if you have a case of measles, you can expect 9 out of 10 people around it to get the case. It's just that contagious. It spreads through the air, much more contagious than the common flu virus, for example. So it's a very contagious disease. Really underscores why the vaccine's the best protection. Chris, just putting a little context around it, before the vaccine, 500 people would die every year from measles in the United States, and thousands in the hospitals. We'd see all kinds of problems from it. Pneumonia, all kinds of problems. Terrible disease.
Can you just walk us through some of the signs and symptoms of measles? Because obviously it hasn't been on the forefront of people's minds for so long, but now that there are some select places where it is kind of a little bit of a firestorm, what are some of the signs? Yeah,
so first keep in mind, you'll show your first signs about a week or two after you've been exposed. And, you'll often see a fever, cough, runny nose, red eyes. Kind of looks like any other viral illness. But a couple days into it, people get these white spots inside their mouth called Koplik spots. And then 3 to 5 days, that's when you get the rash that kind of starts on people's face just below the hairline, moves down toward their trunk, and you get this nice red, big flashy rash. And that's what measles looks like.
And can I ask you, is there a population that you would say is most at risk for this?
Yeah, get ready for this, Chris. So anybody under 5, and then anybody over 20, anybody who's pregnant, and anyone with a compromised immune system. I think pretty much everybody, Chris, has to be worried about this. And I think this is really what underscores the problem. We have forgotten the impact of this disease. And one of the things I do as the state's doctor is remind you from time to time, I care about you, I want to protect you. The measles vaccine, it's the best protection I have for you.
Yeah, this is something we don't want making a comeback. New York State Health Commissioner James McDonald. James, thank you. Appreciate you taking some time for us. You got it.
Have a great day.
And you.